pleasure to welcome you all to this edition of Fever Quiz on behalf of Fever Foundation. Before we start the quiz, I would like to very briefly tell you about Fever Foundation. Fever Foundation is an independent, non-commercial foundation supporting the educational and academic activity. It is to address the unmet needs in fever management. The foundation is committed to conceive, build, and sustain program and make scientific initiatives which are aimed at providing evidence-based update to healthcare professionals. The vision of Fever Foundation is to strive towards imparting knowledge on the unmet needs and provide information on research, education, and therapy updates on fever management. And we have several activities under Fever Foundation. One, we conduct annual fever conference. We have already conducted 6 years continuously a national conference. This year it will be the seventh year, and where all the specialities, it's a multi-speciality or cross-speciality conference where all the specialists who manage fever come under one roof and discuss about various aspects of the fever, which includes physician, pediatricians, infectious disease, critical care specialists, pathologists, microbiology, etc. All would come and discuss about various aspects of fever. And we conduct throughout the year fever CMEs, and we bring about books on fever management. Already we have 13 books have been brought in. And so every year post conference, we bring about two books. One is for pediatrics, one for physicians. Then we also started clinical epidemiological research. First original research have started. And we have challenging case presentation competition for postgraduate, Young Scholar Awards, patient education, paramedical education, parent education, and public awareness activity. This year, we started a Fever Week celebration, which was between 24th and 30th May. It's the first time in India, I think it is first time in the world where Fever Week was conducted. This is to commemorate the birth anniversary of Sir Gabriel Fahrenheit, who invented thermometer and Fahrenheit scale. And during this week, we had mega webinars, national panel discussion on what are the errors in the management of fever. For pediatrician, it was on 24th May. For physician, it was on 25th May. Then we have a CMEs, conducted more than 100 CMEs throughout that week across India. And we also had patient public education activity through FM radio. And our kind advisory board members, they took it up this activity, and then they did this educational activity through all the regional languages. Then we have also started fever research activity this year. First original research activity has been initiated at LN Medical College, Bhopal. And fever quiz is another activity which we do every year. Now we are ongoing is a zonal quiz, which started on 23rd and 24th. It will go for another 2 days, 25th and 26th, where the winners from the region or the zone will, first and second winners will be qualified to enter into the national quiz competition, and they will win the national prize. And all every day we have pediatricians quiz at 4 p.m. and internal medicine at 7 p.m. And we do have poster presentation competitions. Please note, for pediatrics and internal medicine, these posters have to be related to fever. It can be original research, it can be case presentation. The last date for submitting your posters will be 10 September. And the competition for this will be held on 17th or 18th of October. So we have developed training modules. This is certificate course for general practitioner and family physician. And I would like to take this opportunity to invite you all for FEFCON 2024, sorry, uh, which is going to be the 7th annual national conference of Fever Foundation. It will be on 23 and 24th, and we will be sharing all the links and the details to you. Please do attend. There will be a lot of very good scientific discussion which happens, and we have eminent speakers in India, and also international speakers will be coming and discussing about various aspects of fever management. So today we have with us for the quiz, we have our Dr. Ramesh Agarwal as the quiz master. Dr. Ramesh Agarwal is professor of medicine at Lady Hardinge Medical College. He's done his MD and FRCP and FICP. He has more than 20 years of teaching experience, and he has been an investigator for various research projects and clinical trials, and he has guided many ICMR, STS, and postgraduate student. He has more than 100 publications published in very peer-reviewed medical journal for his credit. And He has additional charge of Assistant DG Non-Communicable Diseases, Ministry of Health and Family Welfare. He's a subject expert in various technical committee of Ministry of Health and Family Welfare. And he's a General Secretary, Delhi Diabetic Forum, Treasurer of ISCR, and member of governing body of API Delhi chapter. So Dr. Rameshwar Agarwal, sir, thank you very much for accepting.
Yeah, namaskar, madam. Thank you.
Welcome.
Yeah. Well.
We have with us quiz host, Dr. Anupam Prakash. Sir is the Director and Professor of Medicine and Head of the Department Accident and Emergency at Lady Hardinge Medical College, Associated Hospital, New Delhi. He's also Editor-in-Chief of Indian Journal of Medical Specialty. He's been Associate Director for API Textbook of Medicine, member governing body of API, President Board Management of Delhi Diabetic Forum. He is also President Indian Society of Atherosclerosis Research and Vice Chairman of API Delhi chapter. Member Advisory Board of JAPI, JIACM, Journal of Case Reports, and he has been the founder member of Advisory Board member and the founder member of Fever Foundation.
Welcome, everybody.
Thank you very much, sir. Welcome to you. And thanks for accepting to the quiz host, sir. Welcome. And we have two experts with us, Dr. Ghanshyam Pangte, sir, Professor of Medicine at Lady Hardinge Medical College, and Dr. Shubha Lakshmi Magrekar. She's also Professor of Medicine at Lady Hardinge Medical College. Welcome to both of you.
Thank you,
We have with us the jury, Dr. M.K. Sudarshan, sir. Sir is the ex-chairman of Karnataka State COVID Technical Advisory Board, Government of Karnataka. He is also founder member of a Fever Foundation. He is guiding at various epidemiological aspects. He's also ex-director of retired dean and principal and professor of HOD, Community Medicine, Kempegowda Institute of Medical Sciences in Bangalore. He's a member of WHO Expert Consultation on Rabies at Geneva. He's an NABH assessor of clinical trials and ethics committee. He has more than 100 publications, both in national and international journal. He has authored several books, and he has several awards and accolades credit, which includes Dr. B.C. Roy Award, highest award from Government of Karnataka, Rajyotsava Award, Best Doctor Award, and Eminent Teachers Award from Rajiv Gandhi Health University. So, Dr. Sudarshan, sir, it's our pleasure and privilege to have you as quiz, sir. Welcome to you, sir. Before we go to the quiz, I just would like to tell you all of you some of the rules and regulation of the fever quiz. This quiz is for postgraduates only. The quiz consists of multiple choice questionnaire. There'll be 15 seconds for you to answer each question. The option to be selected by clicking on the button on the text panel. The video display with option is only for representation purpose only. I would like to repeat this. You have to select the text panel which is below this video, what you are seeing, and then you have to only select the option on the text and then submit it. They don't try to put on select the option on the video. It is just an representation. And participants are advised not to leave the platform. Once the answer is submitted, you will not be possible to revert it. There is no negative marking in this quiz. The winner will be maximum fast right answer. If there is a tie, the tiebreaker round will be conducted, and the decision will be done on the winner of the tiebreaker round. And please note, it is advisable to use laptops or desktops. You should not use mobile phone for getting the answer from any colleagues or sitting nearby. Fever Foundation is not responsible for any form of technical error, for example, poor net connectivity. Participation in the quiz implies that the participants accept integrity of these rules. The participants who have given incomplete or inaccurate personal and contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participation in the quiz and candidature for the prize. The first and second winner from each zone will enter the national level quiz competition. It will be held at FEFCON 2024, which is scheduled in November 2024. And finally, the quiz master and judges' decision will be filed, and all should abide by that. So with this, I wish you all luck, and I hand it over the session to quiz host. Over to you, sir. Thank you very much.
A very good evening. Thank you, Dr. Manjula. And at the outset, I thank the Fever Foundation for giving us an opportunity to be conducting this fever quiz year after year. And this is, as Dr. Manjula said, this is the 7th year running. And it is a proud privilege, and we welcome all the participants on board. So just two things I would like to say, that whether or not we win the awards, it is important to participate. And as yesterday I said, there are two things which is important. Number one, having knowledge. That is the most important thing, that you should be able to answer correctly. So that is a reflection of the knowledge that you have. The other thing is that you should be able to answer correctly within a very short duration of time. That is what the fastest finger gets the reward here. So that actually tests your presence of mind, your ability to have your knowledge refurbished or brought to the scene as early as possible. So emergency settings, be it in your profession or be in life, this is important. So those two things come to test in this small quiz that you are going through. So all the best and congratulations for participating. And not only Dr. Ramesh Agarwal, who is the quiz master today, but also Dr. Ghanshyam and Dr. Shubhlakshmi are very seasoned physicians as well as people who have been conducting this quiz year after year. So hats off to them for conducting it so well every year. And I have specifically not mentioned Dr. Sudarshan's name at the outset early. So Dr. Sudarshan, he is a very senior person, already enumerated his credentials. But the thing is, the best thing that I would owe to him is that he has been there year after year for this quiz. And he is a very respectable and venerable figure. And I adore him a lot. He has a lot of support and affection for me, which I am grateful to him for that. So that is a small thing that I do need to mention, although it may not appear to be a part of the quiz forum, but it is important. This is important for our profession also. Those who are white-haired, senior persons, I mean, and they have the very great experience. That is what actually counts in a profession. So he will have the younger person knows the rules, the elder person knows the exceptions. That is how it goes. So that is why it is important for all of us to appreciate Dr. Sudarshan's presence every year after year. Well, with those little longer words, I would request Dr. Sudarshan sir to say a couple of words so that the participants feel enlightened also by his presence.
Thank you very much, Dr. Anupam Prakash ji, and also Dr. Manjula, Dr. Ramesh Agarwal, Dr. Shubhalakshmi, Dr. Ghanshyam Pangte, and all others who are here. And I am from the discipline of community medicine. And so to that extent, I am neither a pediatrician nor a physician, but I am there in both the groups as a jury.
Sir, you are a better physician because you are a physician in the community.
Yeah, thank you. So my message to the participants is, you play with the spirit of participating for the joy of learning medicine through quizzing, and I will not take more time, and be fast, because ultimately fastest finger correct answer will be the winner. So with this few words, it is over to Dr. Anupam Prakash and Ghanshyam Pangte.
Well, thank you, sir.
Thank you.
Well, thank you so much, sir. I think we will pass the baton to today's quizmaster, Dr. Ramesh Agarwal, and I will request Dr. Ghanshyam and Dr. Shubhlakshmi, both of them, to please play a role during the time so they can highlight things, because at times when you are presenting, you don't understand and some things need to be added. So apart from Dr. Sudarshan, both of you are also welcome to add, because Dr. Sudarshan, so obviously he will give his expert advice. Thank you, sir. Over to Dr. Ramesh, please.
Yeah, thank you.
Thank you, sir, and good evening to all the participants. And with those words of wisdom from the grade and the graying hairs, what we see on the screen, I would like to start the quiz. The rules have already been mentioned by Manjula ma'am, and we will have a couple of dummy questions which will be played. And when they are playing, I will just highlight what you have to take care and how the sequence of events are going to take place. So we will have Computer Ji with us, who will be helping us. So we can start the dummy questions, Computer Ji.
Yeah.
Yes, this is Fever Quiz 2024, which is on the screen. I hope all the participants can see And these are the these are the rules which were already told by Madam. So this is the first question. The first question is on your screen is, which animal is known as the sheep of the desert? And your choices are A, horse, B, camel, C, donkey, and D is zebra. And you will have 15 seconds to answer. Computer ji, please start the timer.
Sound is not there. Sound. Timer sound.
Yes, computer ji, sound is not there. So the time is over. And we have got a very interesting question in front of you. Which animal is known as the sheep of the desert? Of course, sheep of the plains, I think it should be horse. But sheep of the desert, if let us see how many know who is the sheep of the desert. So this is the way that the quiz is going to play. And we will wait for some time. In this precious time, we will be discussing about the choices which are there. And certainly, as Dr. Sudarshan sir has told, that it will be learning and quizzing. So we will make sure that every question gives you something to learn. And after a certain time, Computer Ji will help us in the, so which is the right answer, let us say. Computer Ji, which is the right answer? So camel is the right answer. And will you display, Computer Ji, how many participants have given the right answer?
It will do. It will do.
Yeah, I think they are doing the computation on that thing. So again, donkey and zebra, they do not seem to be the sheep desert. Donkey has its own, and zebra has its role in the, I think, zoo.
This is a
So we're
dummy
waiting for
game,
some time.
for them to participate and learn. There'll be
Yes.
such 3 dummy questions, sir, so that they
Yeah,
will
next we'll go to the next one. Yeah.
Yeah,
No,
the graph
will
is
they?
ready. Can we show? We want to show them how actually it goes.
Yes, I think they will show the result
Graph,
also, ma'am.
everything. Yeah, they'll show everything. Yes.
Yes.
Okay,
so
then
they
we'll
are,
wait. We'll wait.
yes, yes. So we can have only 2 dummy questions.
Yeah, 3.
One was
3
this.
we-
Three.
Okay, you want to play 3? Okay, ma'am.
Yeah,
Yes, sir.
three.
So this is the score, and
Yeah, good.
95%, but strangely 5% still have a difference of opinion in this. So, okay, so this is the right answer, and many of you knew this, right? And Anirudh R has been the correct one and the fastest one in answering this question, and he is from KIMS College in Karnataka.
Now, how
Okay.
many seconds it is not there? I think RX events, you have not given the time. 1 second, 2 second, 3 second. How much time did it take? Anyway, that
Yeah,
is
next
missing.
next time, next question, please run it as the
Yeah.
regular quiz so that
Yeah.
the people will
Yeah,
understand.
so the next
Yeah.
question should have
Okay.
Yeah.
the music also,
Yeah.
and the time
Yeah.
also.
Correct.
So let us go to the second question.
Next dummy.
Next dummy question, Computer Ji.
It's okay.
Yeah, please go to the second question.
Yes, the second question is on your screen now. A leap year comes once in how many years? So this is the second question, second dummy question. And the choices for this is A, is it 6 years? B, it is 3 years. C, is it 4 years? The timer. And
No,
the
D is
D
14.
option is 14 years. So the time starts now.
Yeah.
Yeah, so this will be the time how it is going to play. Yeah, so the time is over. And what is the correct answer, Computer Ji? So after every 4 years, you have got a leap year. So what is a leap year? Why does leap year happen? So it comes after every 4 years. So Dr. Anupam sir is there, who will, I think, enlighten us
I
about
just
leap
want to
year.
highlight that this is the leap year. This year is the leap year.
I
Yes,
will
sir.
tell you, February will have 29 days. 29 days.
Yes,
Yeah,
and
that
one
much
and
I
once
know.
yeah, and one who has a birthday on 29th of February, he
Yeah.
celebrates his birthday after every 4 years.
Yeah.
Yeah. So Computer Ji, are we ready with the answers? And how many participants have correctly answered?
Late Shri Morarji Desai ji, our Prime Minister, he was
Yes,
born
sir.
on 29th February.
Okay.
Yeah,
So,
as far as my memory goes correct.
yes, sir. You are very right, sir.
Yeah,
So
not
I
bad.
think now,
Not-
yes, sir. So many of the participants know about the correct answer. And who is the fastest one to answer this question?
winner, yeah.
Yeah, he's
One
Samaran Karoda is from Srihar State, Tamil Nadu, and she has taken just 1 second to answer this question. Congratulations on winning the dummy question. But this is certainly not going to give you prize.
Yeah.
And we can switch over to the third question. Computer ji, third dummy question. The
Yeah.
third dummy question is baby frog is known as. Your
Yeah.
choice is A, cup, B, pony, C, tadpole, and D is larva. And your time starts now. Yes, so the time is over. What is the correct answer for question number 3, computer G? So it is tadpole. So this is how the quiz is going to run. The best way to answer any question is that to rule out certain choices in this. Like in this question, you can safely rule out A and B, and the close ones can be C and D. And among C and D, you can just answer and make it very quick so that you become eligible for the prize. Computer ji, are we ready with the correct answer and the how many participants have answered it correctly?
Perfect.
Okay, they'll come. They'll tell, sir.
Yes.
So this is the last dummy question. Yeah.
Okay. Okay.
So many of you have answered it correctly, 97% of the participants. How many participants we have, ma'am, at the moment?
70 plus.
Oh,
sir.
that's a
Oh, very good. Very good.
that's a good number. So the competition is going to be very healthy.
Mm.
Right. So this and who is the winner for this question? So this is Swetha S again from PSG IMSR from Tamil Nadu, and she has taken 2 seconds to answer this question. Okay, so this ends our dummy run for this quiz, and we will be starting the original quiz. Right. So we are now starting the quiz. So please be ready. I hope you are all ready with on your desktops. And your question number first for the South Zone is on your screen. A 30-year-old woman presents with fever, severe headache, and a petechial rash. CSF examination showed organisms as shown in the image. What is the likely causative organism? Choice A, is it Streptococcus pneumoniae? Choice B, is it Neisseria meningitidis? Choice C, is it Haemophilus influenza? And choice D, is it Listeria monocytogenes? And your time starts now. Yes, the time is over. I hope you all have answered this question. What is the correct answer, computer ji? So the correct answer is Neisseria meningitidis. So why do we say this is Neisseria meningitidis? If you can see the diagram which is there, the image which is there, so they are diplococci. What are diplococci? Diplococci are, if you can see, they are kidney-shaped organisms which are there, and they are gram-negative Diplococcus organisms. And how do they correlate with the clinical history which is given over there? That this lady has some fever and signs of meningitis, severe headache, and a petechial rash. So meningococcemia, they generally present with a disseminated infection where there is bacteremia, and they present with a rash. Rash is very typical. It may, then the patient may undergo severe sepsis, hypotension, and that we call it as meningococcemia. Sometimes the main thing to learn about meningococcal infections is that apart from the infection which they cause, the relatives, the caretakers, they also become the carrier of this organism. They harbor this organism in the nasopharynx, and because of this, the infection is through the aerosol. So it is always advised to give chemoprophylaxis to the relatives, to the caregivers who come in contact with the patients who are suffering from meningococcemia. The diagnosis is, you all know that if we want to diagnose patients of meningococcemia presenting with meningitis, so a CSF you can do a CSF lumbar puncture, and in the fluid you can see these organisms, or you can take a blood culture. In that also you can see these organisms. Computer ji, are we ready with the number of participants who have correctly answered? So 71 have rightly answered this, and there was some doubt in the choice first, third, and fourth. But the organism which was shown in the image, it was very typical of Neisseria meningococci, Diplococcus gram-negative. And who is the winner for this question? It is Mohammad Akram Khan from Government Stanley Hospital, Tamil Nadu, and he has taken 2 seconds. Congratulations, Dr. Mohammad Akram, for winning this question and being very fast in answering this. So clinically relevant question.
2 seconds.
Congratulations.
2
So-
seconds. 2 seconds.
Just 2 seconds to answer this question.
Yeah.
So can we switch over to the second question, Computer ji? Now, this question is again very interesting. A 35-year male, he developed some rash, an itchy skin rash that started on the abdomen, and it then spread onto back and face and arms as shown in the image. What is the likely diagnosis? Do you think this rash is of smallpox? Is it of B choice varicella, C choice drug eruptions, or D choice, is it dermatitis herpetiformis? And your time starts now. The time for this question is over. Computer ji, what is the right answer for this question number 2? So it is varicella. And the clinical problem given over here is that he's a young male and he has developed a rash. Now, to answer such questions, we should know where, let us go one by one, why it is varicella and why not others. Because varicella is a disease which has its rash starting from the trunk or the arms, and then it spreads to the periphery. It typically starts on the chest, back, and face. And when it is a primary infection, it presents in the form of a chickenpox. And when it is a reactivation, then it may present to you in the form of herpes zoster or shingles. And it is acquired by inhalation of infective aerosolized droplets. So it is a communicable disease that once you come in contact with the patient, so you may have a primary infection, and if you had an infection earlier, so it may be reactivated and you develop herpes infections. Now, dermatitis herpetiformis, which is the fourth choice, it is a disease where the rash is symmetrical and it is present with some blisters. In this particular diagram, you can see that the rash is in many phases. Some of the lesions are healing, some of the lesions are vesicular. So it's a polymorphic type of a rash, which is typically seen in varicella. Again, drug eruption rashes are generally symmetrical, and they do not typically the back of. Smallpox is eradicated, but still to know they have got a very large type of rash. They are blisters, but they again tend to be symmetrical in presentation. So the correct answer for this question is varicella. Computer ji, can we have the correct number of participants? So 73% of the participants were able to tell the answer rightly. So very nice. And who is the winner for this question? So the winner is Praneet Perumala, and she is from Kohut, and she has taken 3 seconds. So she has rightly and very quickly identified the lesion. Congratulations, Dr. Pranitha, for answering this question correctly. So we can move on to the question number 3, Computer Ji. So the question number 3 is on your screen. Who discovered Mycobacterium leprae? Was it Robert Koch? Was it Kitasato Lepa? Was it choice number C, Gerhard Hansen? Choice number D, was it Louis Pasteur? Time starts now. I think the question is very easy. You should not take more than 2 seconds or 1 second.
100% answer this time.
Answer should be 100%. And your time is over. And what is the correct answer, Computer Ji? Is choice C, as the name itself suggests, for which we call leprosy as Hansen's disease. And the full name of the scientist who discovered this was Gerhard Henrik Armeur Hansen, and he was a Norwegian scientist. And he discovered that Mycobacterium leprae as the causative organism for leprosy. And with this discovery, he was able to demonstrate that leprosy is a disease which is caused by an organism, and it is not something which was predicted that it is some hereditary type of a disease which runs in the family. And in this way, he got to, and the disease was named after Mr. Dr. Hansen. Then Robert Koch, we all know about him. He was a German physician and a microbiologist, and he was responsible. He was the discoverer of tuberculosis, cholera, and anthrax. And Louis Pasteur, he became a pioneer in the development of vaccinations for anthrax, cholera, and his rabies vaccine. Choice number B, I do not know. He is something which we have manipulated, and he does not exist. So let us go to the Computer Ji, who is how many participants have correctly answered this. So again, yes, so 68% have answered. There was, it is not the 100% result which we expected. So at least we have learned from this question that Hansen's disease is known as leprosy. Someone who is knowing it might have answered it correctly. So who is the winner for this question, Computer Ji? And we have Abhishek Shri V from, it is, I think, Madras Medical College from Tamil Nadu. And very less time as we expected, 1 second. Very rightly answered. Congratulations, Dr. Abhishek Shri, for answering this question. So we move on to the next question. Computer Ji, next question, please. So now we are on question number 4 of the quiz. All of the following are criteria for systemic inflammatory response syndrome, SIRS, except choice A, heart rate is more than 90 per minute. B, temperature more than 38 degrees centigrades or less than 36 degrees centigrades. C, systolic blood pressure is less than 90 millimeters of mercury. And choice D, respiratory rate is more than 20 per minute. And your time starts now. So the time is over, and we can have the correct answer, Computer Ji. So the correct answer is that the systolic blood pressure is less than 90 millimeters of mercury is not a part of SIRS. So over the last many previous quizzes and yesterday also, this question is one of the very important questions. That's why it is being repeated every time in the quiz in some or the other form, because this is one way of identifying patients in the emergency where we can predict the morbidity and mortality and of the patient, and we can decide whether this patient's, or we can triage the patient, that this patient needs your urgent attention in the form of some emergency treatment, or some other patient who presents with more severity needs your urgent attention. So the criteria for SIRS is that the body temperature over 38 degrees or under 36 degrees, heart rate more than 90 beats per minute, respiratory rate more than 20 breaths per minute, and the fourth one is the leukocyte count, which is greater than 12,000 or it is less than 4,000. And so these are the four criteria. Systolic blood pressure doesn't find a place in deciding SIRS. And as we discussed yesterday also, someone who has got an infection, he will be termed SIRS with infection will be sepsis. And the patient going into hypotension will be then septic shock. So this is one we should remember while we treat the patients, and for the postgraduates also, we should know what is SIRS, sepsis, septic shock, refractory septic shock. So Computer Ji, are we ready with the results? So again, 24%, 18%, 34%, and 24%. So it's a mix. That means there is a lot of confusion despite being, this question seems to be very easy. Even when we decided to keep this question, we are not very sure whether this is a very easy question or a very difficult question, but the heterogeneity of the result has shown that, yes, we are confused in deciding about SIRS. And who has correctly and fastly and answered this? Again, Mohammad Akram Khan has just taken less than 1 second only to answer this question. So he must be aware of this or probably practicing this in his daily clinical rounds. That's why he could answer this question very quickly. So congratulations, Dr. Mohammad Akram Khan. And we can move to the next question. Computer Ji, next question, please. So the next question is on your screen. It is, which type of hypersensitivity reaction is seen in lepromine reaction? Is it type 1? Choice B, is it type 2? Choice C, is it type 3? Choice D, is it type 4? And your time starts now. And we expect this to be an easy question. Yeah, the time is over. And can we have the correct answer, Computer Ji? So it's a type 4 hypersensitivity reaction. It is not important. It is not much important which type of reaction is. The purpose of giving you this question is, what is a lepromine test? Does it still hold any value today? So I will just tell you what is a lepromine test. So lepromine test is a prognostic test to test the cell-mediated immunity to Mycobacterium leprae. But practically, it has got a limited practical use these days. It involves the intradermal injection of some bacilli which were heat-killed, and they were derived from the infected armadillos. And after a few days, 1 to 2 days, the first reaction was red, and it was the Fernandez reaction, which occurs within the first 2 days, and it represents a delayed type of hypersensitivity reaction. And at 3 weeks, it was the Mitsuda reaction which was measured. So some historical interest is there in this particular question. And the positive Mitsuda reaction is described as an indurated lesion of more than 4 millimeters, which histologically shows granuloma formation. And a positive reaction corresponds to the acquisition of cell-mediated immunity against the Mycobacterium leprae, and it occurs in tuberculoid leprosy patients. Borderline leprosy patients showed a lesion which was less than 3 millimeters, and lepromatous patients showed a negative reaction. So there are two ends of the leprosy, we all know, the tuberculoid and the lepromatous end. So the extreme lepromatous end do not show this reaction as positive. So Computer Ji, are we ready with the results? So many of you knew this, that this is a delayed type of hypersensitivity type 4, and 74% of you have correctly answered. For those who had some confusion, I think the brief discussion which we had will surely clear the doubts, and you will also read what is type 1, type 2, type 3, and type 4 hypersensitivity reactions. And who is the winner of this question? So another winner who has come is Sabarish J, and he is from Kelpok Medical College, Tamil Nadu. So if I am right, then Madras Medical College, Stanley, Kelpok. So all the three medical colleges from Tamil Nadu have a 1-1-1 winner, and he took just 1 second. Congratulations, Dr. Sabarish, for answering this question correct. And we can move on to the next question. Computer Ji. So the next question on your computer is question 6. It is a middle-aged male who presents with 15 days of fever.
Recording in progress.
Yeah, your time is over for this question. And Computer Ji, can we have the right answer? So it is hyperglycemia, which is not present in severe malaria or malaria caused by Plasmodium falciparum. Now, again, this question is just like SIRS, which I discussed a little back. That again, this question has found a place in many quizzes, and some of the other form yesterday also a part of this was there. The idea of putting this question is to make you aware of the sensitivity that malaria still holds true in our population. It is a disease which can be severe. It doesn't matter now whether it is Plasmodium falciparum or Vivax. Both can present with the complications and with the severity. The treatment part was discussed yesterday by Dr. Ghanshyam, and as per new guidelines, even for malaria in pregnancy, artemether has been approved. So coming to this particular question, hyperglycemia is not a part of complicated malaria. It is hypoglycemia. And because drugs like quinine used to cause hypoglycemia, and the malarial parasites also cause hypoglycemia. So that's why hypoglycemia is a known complication in malarias. Kidney failure, altered sensorium, low hemoglobin or anemia, metabolic acidosis, acute respiratory distress syndrome, raised bilirubin in the form of jaundice, hyperparasitemia, hyperlactatemia. So these are other manifestations which can be present in severe malaria. And I think these are practical also when we see the patients of malaria, and by assessing these parameters, we assess the severity of the disease of the malaria parasite which they present to us. So Computer Ji, do we have the answers on the correct participants? So it is 79% were able to answer it correctly. Still, there was some doubt in the minds of around 20 to 25% patients. But I think with the brief discussion, this will clear their doubts. And who is the correct winner of this question? Is Dr. Saeed Saklain from Mysore Medical College, Karnataka, and only 2 seconds he took to correctly answer the question. Congratulations, Dr. Saeed, for answering this question correctly. So Computer Ji, can we have the next question on the screen? So question number 7, the rapid bedside screening tool for sepsis derived from the longer sequential organ failure assessment scoring system includes all of the following except choice A. Is it systolic blood pressure is less than 100 millimeters of mercury? Choice B, respiratory rate is more than 22 beats per minute, heart rate more than 90 beats per minute, and altered mental status, choice D. So your time starts now. Yeah, so the time is over. And what is the correct answer, Computer Ji? So the correct answer is the heart rate more than 90 beats per minute do not find a place in the assessment of longer sequential organ failure assessment scoring system. So it was a little tricky question. The question is just asking about the QSOFA score. And you all know that some scoring systems are available these days, which may be short like a QSOFA or Apache or other systems which are there, which quickly assess the patient's severity in the bedside, like the one which we discussed a little before, like SIRS. Similarly, so in QSOFA, it has got three components which are assessed. One is the systolic blood pressure. If we find it less than 100 millimeters of mercury, the respiratory rate, if it exceeds more than 21 or 22 beats per minute, and the Glasgow Coma Scale, if it is under 15, which is the choice D, that is altered mental status. And heart rate do not find a place in assessing this thing, so it can be ruled out. So these are basically certain scores which have been done in the research also, and they have correlated these scores with the mortality which the patients can have when they present with increased scores. So Computer Ji, are we ready with the number of participants who have answered it correctly? So it is 52% have tried to answer correctly, but there is a lot of confusion, and we expect this also because scoring systems are something which is not easy to remember, easy to mug up. So who is the fastest winner for this question, Computer Ji? And again, Dr. Mohammed Akram Khan from Stanley Hospital, he has won this question, and in almost 1 second. So congratulations again, Dr. Mohammed, for answering this question correctly. So we can move to the next question. Computer Ji, next question, please. So the question is on your screen. Question number 8. The gold standard for treatment of brucellosis in adults is A, is it ceftriaxone and rifampicin? Choice B, is it streptomycin and doxycycline? Choice C, is it gentamicin and ciprofloxacin? Choice D, is it trimethoprim, sulfamethoxazole, and rifampicin? And your time starts now. Yeah, so the time is over. Computer Ji, can we have the correct answer? The correct answer for this question is choice B, which is streptomycin and doxycycline. So the topic brucellosis over the years is gaining importance, as it is one of the diagnoses which may be missed, which may be missed because it is generally confused with tuberculosis, especially tuberculosis of the abdomen. And if we do not take a proper history suggestive of consumption of unpasteurized milk or coming in contact with the animals, so we may not even think of diagnosing brucellosis. There are many questions which probably will be coming in the quiz, and so we will be just restricting our discussion on the brucellosis to the treatment part. So what all can we give in brucellosis? I think most of the drugs which are mentioned over here can be given in brucellosis, but as per WHO, the gold standard for treatment for brucellosis is streptomycin and doxycycline. This is the correct answer. In some cases, we can also give rifampicin. We can also give trimethoprim, sulfamethoxazole. We can also give gentamicin. But again, if we are talking of the guidelines which say the gold standard, it will remain as it still remains as streptomycin and doxycycline. So, Computer Ji, are we ready with the number of correct answers? So 57% of the students have been able to correctly pick it out. And choice C, I don't remember, but it seems that people are very sure that choice C is not the answer. And so gentamicin and ciprofloxacin, students know that it is not the treatment for brucellosis. Confusion was there between ceftriaxone and rifampicin, and there was confusion between trimethoprim and rifampicin, and we do agree that the confusion can occur. And who is the winner for this particular question? Computer Ji? So this is a new person who is coming over here. He is Dr. Gokul Kanagla, and he's from Mysore Medical College, Karnataka. And he has taken 4 seconds, thought a little bit, and then answered. Congratulations, Dr. Gokul, for answering this question. It was a tricky question, and many congratulations to you for answering this question. Computerji, next question. It is question number 9, I believe. Yes, so the question number 9 is on your screen. Which of the following is not an immunological evidence of infective endocarditis? Choice A, is it glomerulonephritis? Choice B, is it Roth spot? Choice C, is it Osler's node? Choice D, is it Janeway lesions? And your time starts now. The time is over. And Computerji, can we have the right answer for this question? So the Computerji says that Janeway lesions is not an immunological phenomena of infective endocarditis. So again, again a topic which is both of clinical importance, which is of importance from the examination point of view for the postgraduates. And these are certain questions like the immunological phenomena and the vascular phenomena, the criteria for diagnosing infective endocarditis, the method by which you take the blood culture for endocarditis, the treatment of infective endocarditis, and the atypical organisms which can cause infective endocarditis. So these are going to be asked frequently and endlessly. So just to summarize, what are the vascular phenomena? Vascular phenomena in infective endocarditis are major arterial emboli, septic pulmonary infarcts, mycotic aneurysms, intracranial hemorrhage, conjunctival hemorrhage, or Janeway lesions. So the question was about the immunological phenomena. The immunological phenomena are like glomerulonephritis, Osler's node, Roth spots, rheumatoid factor. So Janeway lesion is not an immunological phenomena, it is a vascular phenomena. Computerji, can you show the number of participants who have answered it correctly? And the number is 48% who have answered it correctly. The Janeway lesions do not form a part of immunological phenomena. But still, as I mentioned in the beginning, like severe malaria, like SIRS, like infective endocarditis, these things are there which will always have some confusions. And so the heterogeneity of the result shows that we need to practice this, because certainly these are things which we cannot ignore in our day-to-day practice. And who is the winner for this question? So again, we have got probably a new winner. She is Dr. Divya R from Cuddalore Medical College, and she's from Tamil Nadu. And she is very, I think, very much confident that she took almost a second to answer this question. Congratulations, Dr. Divya, for remembering the criteria and answering this question. Coming to question number 10, which will be halfway for our quiz. Computerji, can we have question number 10 on the screen? Again, the question which I told the topic is very interesting. Brucella is transmitted by all except through the placenta of animals. Aerosol transmission, this is choice B. Choice C, person to person. Choice D, is it eating uncooked food? And your time starts now. So the time is over. And Computerji, what is the correct answer for this question? Person to person. So transmission by person to person is extremely rare in brucellosis. The other forms Brucella can be transmitted. Just to enlighten you about Brucella, it is which we have been asking in the previous quizzes also, that brucella or brucellosis is also known to cause remitting fever, undulant fever, Mediterranean fever, Maltese fever, Gibraltar fever, Crimean fever, goat fever, and Bang disease. So many other names may be there which are known for brucellosis. So it just highlights the importance of brucellosis. Probably in northern part of the country, we are not diagnosing the case as frequently, maybe because of, again, unawareness, because of, again, not thinking of diagnosing brucellosis, exposure to animals or animal products, ingestion of unpasteurized goat milk, aerosolization of fluids, and people in the laboratories, they all can catch the brucella infection by some or the other way. So boiling or the milk still remains a healthy practice to avoid infections which are coming from the dairy products. So the correct answer to this question was that it is very extremely rare that brucellosis is transmitted person to person. Computer ji, are we ready with the results? So 69% of the students were able to tell that brucellosis is not transmitted by this thing, by contact with the person to person. And who is the correct winner for this question? She's Dr. Sheetal R, and she's from ESIC College and from Karnataka. And she has taken just 1 second to answer this question. Congratulations, Sheetal R, for answering this question. Yes. So, Dr. Manjula, will you like to tell us about the...
Yes, sir.
Yeah, yeah.
Can we see the halfway through what is the status, sir? Computer G, can you show us after 10 halfway through the what is the standing of various participants?
Computer G is calculating.
Yeah, they're ready.
Calculating the results. Yes. So, as expected, that Mohammad Akram Khan could answer 3 questions, and he is leading the list. Abhishek, Sheikh, Shri, and the others have got 1 answer correct. So, Dr. Ghanshyam and Dr. Shubha is also with us. And it is that, Dr. Ghanshyam, that we have got a person who has got 3 correct answers. And as we saw yesterday also, that the tables can be turned, or someone from below can surely come in the race and compete.
Yeah, it's just halfway through and very smoothly conducted quiz, Dr. Ramesh. I think they have shown the question also, question number 11. You can continue it. So, thank you. It's very, very conducted, sir.
Yes, sir. So let us begin with the second part of the quiz. Question number 11, Computer G. So the question number 11 is, which of the following organism is responsible for causing primary amoebic encephalitis? Choice A, is it Naegleria fowleri? Choice B, is it Toxoplasma gondii? Choice C, is it Pseudo-Alteromonas? Choice D, is it Firmicutes? And your time starts now. Your time is over. And what is the correct answer for this, Computer G? It is Naegleria fowleri. So again, this question is particularly framed keeping in view the current scenario which is happening in the southern part of the country, where where you all are the participants today. And probably it should not go into the epidemic or the endemic forms. That's why a lot of surveillance is now being done. Not a very common disease, but a disease which can be fatal. If we have to tell you something about amoebic meningoencephalitis, it can be of two varieties, which is the primary amoebic meningoencephalitis and the granulomatous amoebic meningoencephalitis. Although the organism which has been mentioned here is Naegleria fowleri, the organism which probably has been detected in the case which was found in the southern part in Kerala in the recently affected patient was Vermibiba vermiformis. So what are these amoebas which can cause such type of meningoencephalitis? So they are free living amoeba, and person get exposed to them when they try to swim in the area where these organisms are already there. So this organism has been found to infect in healthy children and adults who go for such recreational water activities like swimming, diving, and water skiing. Some isolated case reports have been there for different other methods by which this can be acquired by a human beings. But primarily these free living amoebas are generally infect when someone goes into those swimming activities. The problem with these organisms is that they are rapidly causing deterioration in the human health, and they may lead into picture of meningoencephalitis. Difficult to diagnose. Treatment will remain symptomatic with amphotericin B, sometimes azithromycin, fluconazole. So this was what we have to tell you about this disease, which is rare but certainly of importance. The computer Ji, are
Dr.
we
Ramesh, I
ready
would
with
like
the
to add
results?
few points here.
Yes, Dr.
Can
Ghanshyam,
I add
please,
something?
please.
Yeah.
Yes, yes.
I was really surprised to know that 90% of the students that correctly answered it. And I really remember.
No, this is from South India, sir. They have to answer 100%.
Yeah, this was in news because there was a news in the newspaper that brain eating amoeba or infection is going on.
Yes.
And I really remember it's 25 years back. This was one of the D Viva question in our microbiology. And that was asked to top 5-6 candidates. And now I can see that Naegleria fowleri is known to almost 90% of the students. And everyone is very aware. Glad to know that this D Viva question is answered by 90% of majority of people. Great.
Yes.
Hands
Any
off
other
to all
expert?
the
Yeah. Any other expert? If anyone will like to comment on this aspect.
Sir, actually,
Yeah.
what you told is correct, and it is rare, but the mortality rate is very high. If
Yes,
the patient
madam.
is infected and the disease has happened, then mortality rate is very high. So it is important to know.
Yes, madam. You are absolutely right because of the fatality rate. So by the time someone needs to act, the disease has spread, and early action and the if we just look at the treatment, which is amphotericin B, it is not an empirical therapy which we start in the emergency. This is something which we only start when we are very sure about the disease in the diagnosis. So who is the winner for this particular question? So it is Bala Murugan. So Dr. Bala Murugan from Tirunelveli Medical College, Tamil Nadu is the winner for this question. He has taken 4 seconds, thought about it and answered it correctly. Congratulations, Dr. Bala Murugan, for answering this question and learning this aspect of the medicine. So coming to the next question. So we have question number 2. Again, it is a question which is of burning today. With the reference to Chandipura virus, CHPV, which of the following statements are correct? 1, it is primarily transmitted through the bite of infected ticks. 2, it is an enveloped RNA virus. 3, it has high mortality rate. So your choice A is it statement 1 and 2 are correct? Choice B, is it statement 2 and 3 are correct? Choice C, is it statement 1 and 3 are correct? Choice D, is it statement, all the statements are correct, 1, 2, and 3, and your time starts now. Yeah, the time is over. And what is the correct answer, Computer Ji? So the correct answer is choice B, which states that it is an enveloped RNA virus and a high mortality rate, and it seems that it is not transmitted through the infected ticks. So what is Chandipura virus? It is in news these days, as we all know, that it is affecting people in states of Gujarat, Rajasthan, and MP. The virus is again, it is an arbovirus that belongs to the vesiculovirus genus in the Rhabdoviridae family. And since it was discovered in the Chandipura village of Maharashtra in 1965, and it is transmitted through sandfly and generally not through ticks. So it is known as Chandipura. It is known as Chandipura virus. Children are said to be more prone to develop this infection. And again, as we talked of primary amoebic meningoencephalitis, the disease can be of high seizures and convulsions. The preventive measures, as Dr. Sudarshan sir will agree to me, that prevention of bite with the sandfly, exposure to the sandfly should be prevented. The treatment again is symptomatic, and there is no definite treatment as it is a viral disease. Dr. Sudarshan sir, we are talking of the Chandipura virus, sir, and the sandfly which is there. It is not very common to have diseases in North India, especially when we are just struggling with dengue and other diseases which are transmitted by Aedes and Anopheles. Now this sandfly thing is very much bothering for us.
Yeah. So only one thing, let me tell you, I think from community medicine point of view, the mosquito nets will not prevent sandfly. They are smaller than mosquito. So they'll enter the mosquito net. So this is what I have known. Though I have no experience of working with areas where sandfly is present. So it was primarily in Bihar. So otherwise, I think what all has been discussed is fine. Thank you very much. Thank you.
Yes, sir. So I think this is again a very important thing which sir has told, that instead of putting those nets which may not be actually preventing you from infection, use some repellents or something which can kill the flies or the larvae. So can we have the results, Computer Ji? So again, the question was framed like this, that it had to be difficult with a lot of statements and this. And 32% opted for choice C, and 36% opted for choice D. And the correct answer was choice B, and it has been answered by only 18% of the students. So people have tried to be safe. The participants have tried to be safe by answering all the three choices, A, B, and C, and opted for 36%. So who is the winner for this question, Computer Ji? So the question was interesting, it seems. So again, I think a new winner from Bhukia, Dr. Bhukia Haritha Bai, and it is from Patnam Mahindra Reddy and from Telangana. So congratulations, Dr. for winning this question and you have answered it in 4 seconds. Congratulations. This is a thing which is an upcoming disease, and although it has been there since 1965, but we all are not very much familiar with this disease. So coming to the next question, which is question number 13, Computer Ji. Question number 13 is on your screen. It is all of the following are included among the major criteria of the modified Duke's criteria for the diagnosis of infective endocarditis, except A, is it at least 2 consecutive positive blood cultures for Coxiella burnetii? B, is it presence of any new valvular regurgitation? Choice C, is it echocardiography showing endocardial involvement with definitive vegetations? And choice D, is it again Coxiella burnetii IgG antibody titer more than 1:800? And your time starts now. The time is over. And computer ji, can we have the right answer? So the answer is that at least 2 consecutive positive blood cultures for Coxiella burnetii. This is a wrong answer for diagnosing Duke's criteria. So this is not one of the major criteria of the modified Duke's criteria for diagnosing infective endocarditis. So again, as I mentioned, that things like Jones criteria, modified Duke's criteria, so these are some things which are of importance and which invariably are asked in any vivas, any examinations. And the correct answer to this is that it is not 2 consecutive blood culture, it is only a single blood culture, which, if positive for Coxiella burnetii, will be considered as a major criteria. Just to revise about the major criteria about infective endocarditis, any 2 positive blood cultures for typical endocarditis organisms, single blood culture for Coxiella burnetii, or a titer which is mentioned in choice D, that is IgG titer of more than 1:800, or an echocardiographic evidence of a new murmur, or any dehiscence of a prosthetic wall, or if we can see some thrombus which is oscillating. So an oscillating intracardiac mass on a heart wall. So that suggests they are the major criteria. So any of the experts will like to add something, so we can have a discussion more, or we can go to the results.
You very correctly said, sir, because infective endocarditis is one of the very important topic which even in UG or PG should be knowing about. And these criterias, as you very well said, because criterias are the thing which are which don't have any confusion actually. So they are fixed and we should be knowing that. And yes, like here it has one positive blood culture report is good enough for the diagnosis. So it is very important to note.
Yes, thank you, Dr. Subbalakshmi. We all know that when we take the exam, despite very structured criteria which are mentioned in the text, students do fumble when they have to answer about the Duke's criteria. And so the purpose of asking this question and repeatedly asking these questions in quizzes and in examinations is that we should remember these criteria by heart. So what is the result for this question, computer ji? So 67% of the participants have opted for choice A, and that is correct also. But almost 30% have opted for choice D. So there must be some confusion in remembering the antibody titer. So that's quite natural also. But again, the teaching says that you have to remember what is there given in the standard text. So who is the winner for this question, computer ji? So the winner is Dr. Sheetal R, and she is from ESIC and Karnataka, and she has taken 4 seconds to answer this question. Congratulations, Dr. Sheetal. Coming to the next question, computer ji, which is, I think, question number 14. So again, the question is on scrub typhus. The gold standard test for diagnosis of scrub typhus is it A, indirect immunofluorescence, B, is it ELISA, C, is it blood culture, D, is it Weil-Felix test? And your time starts now. And your time is over. What is the correct answer, computer ji? So the gold standard test for diagnosis of scrub typhus is indirect immunofluorescence. And this question is not difficult, I believe, and most of you might have answered it correctly. There may be some confusion between choice A and B, or maybe choice A and D. The gold standard test for diagnosing of scrub typhus is indirect immunofluorescence. The tests which we can do for diagnosing is Weil-Felix, indirect immunofluorescence, indirect immunoperoxidase, ELISAs, immunochromatographic, PCR reactions, bacterial cultures, some CSF evaluations. So what is this indirect immunofluorescence test? So it is based on detecting the antibodies in the patient serum, and a positive result it occurs when the labeled antibody binds to the bacterial antigen on a slide. So we are detecting the antibody in this case when we are doing an indirect immunofluorescence test. But the limitation of this test is that a single titer may not always be diagnostic. So it's always better to have an increase in the titer, which may be fourfold for diagnosing and confirming. But still, this still remains because probably of the availability as the gold standard for diagnosing scrub typhus. Any comments on scrub typhus from the experts?
Here, I think, sir, student might be confused with option D, that is wheel Felix, because it
Yes.
is actually go with scrub typhus, but because of sensitivity and specificity, which is not very good, so we go for this indirect immunofluorescence. And again, scrub typhus, as it is a very important this thing, because nowadays this infection is increasing, or maybe we are aware of the presentation and we are aware of the patient, so we are diagnosing it more. But yesterday also in the quiz, this question was there. So again, we want to emphasize that we should be aware of this condition and we should be able to diagnose it timely and treat it.
Yes, thank you very much, Dr. Subbalakshmi. You are absolutely right that because we are sensitive now to pick up the clinical findings, that's why we are diagnosing scrub typhus, especially in the northern part of the country, where it was not very usual to diagnose scrub typhus and leptospirosis, but because of the availability of the tests also and the sensitivity, we are diagnosing this. So what are the results which are available, Computer G? So see, again, the heterogeneity of the answers, it tells us that although the topic is simple, Dr. Anupam will agree to me. He always emphasizes that we should start from the basics and we should not be very over enthusiastic in jumping from the top. We should start climbing and gradually we should be wise enough. And this results itself shows that still there is a lot of confusion between choice A, B, C, and D. People are opting for whale Felix also. People are opting for blood culture also, ELISA also. But the gold standard remains this. Okay, so who is the winner for this question? So amongst the 36%, Dr. Mohammad Akram Khan has been able to answer it correctly. And he has taken 1 second. He was very sure that this is the correct answer. Congratulations, Dr. Mohammad. I think you are now, you may be probably leading the quiz. Let us see after the end of another 6 questions which are remaining. So next question, Computer G. So question number 15 is on your screen. Which of the following is not correctly paired? Is it erythema nodosum, tuberculosis? Choice B, erythema marginatum, Lyme's disease. C, erythema multiforme, mycoplasma. Choice D, is it erythema gyratum repens, malignancy? And your time starts now. Yeah, so the time is over. And what is the correct answer for these erythemas, Computer G? So the option which is not correct is erythema marginatum is not in Lyme's disease. So I think it will need a lot of presence of mind when you get similar type of things on your screen. So sometimes you may get confused. So let me tell you all the erythemas which are generally in common in use. Erythema nodosum. So this is all we are familiar with, that these are some tender red swellings, especially on the shins, and tuberculosis, sarcoidosis, leprosy, some drugs like sulfonamides, and maybe some inflammatory bowel disease. So this is one generally are picked up. What is erythema marginatum, which is not which is mentioned and which is wrong? It is a non-itchy, pale, red macular eruption. It is a major criteria for diagnosis of rheumatic fever. So erythema marginatum is commonly seen in rheumatic fever. What is erythema multiforme? So these are cutaneous target lesions. Children, young adults, we often see mycoplasma, herpes infections. They are associated with formation of these target lesions. There are another 2 or 3 erythemas which are not mentioned over here. One is erythema induratum. Erythema induratum is cutaneous tuberculosis, and it is otherwise known as Bazin's disease. Bazin's. There is another erythema which is erythema infectiosum, what we call as slapped cheek appearance, and this also students must be knowing. It is caused by parvovirus B19. Another erythema is there, which is erythema chronicum migrans. It is an expanding annular lesion which is occurring in Lyme's disease. So Lyme's disease is associated with erythema chronicum migrans. And it is right, the choice D is right, erythema gyratum repens. It is erythema which is forming repeated concentric rings and may suggest of an underlying malignancy. So all these 7 or 8 erythemas, so they look very close to each other, but they have got the different etiologies. Computer ji, are we ready with the answers?
So thank you, sir, for updating us also about these
Yes.
all arrhythmas.
Yes,
Because
I
it
am
is
also.
not as easy.
Yeah, I was also updating myself when I was going through it. Certainly.
Interesting, very interesting.
Yes, yes. Thank you, Shubhalakshmi ji. Yes, sir.
For me, it was a bouncer.
Yes, yes, sir. Yes. So again, the choice is the choices are split, as we can see. The
No,
correct
my answer
answer,
will be bouncer only.
yes, the correct answer was B, that erythema marginatum was not associated with Lyme's disease, and 40% were able to correctly identify it. And let us see who is the winner for this question. Oh, so Dr.
Yeah.
Muhammad Akram Khan, congratulations. So you have been able to handle this googly and the bouncer also, and very swiftly, just you knew the ball is coming to be bouncer and you have hit it for 6. So congratulations for answering this question. I'm sure that we are going to meet Dr. Manjula in November. Yes. So next question, Computer ji. So next question is, which statement is true about enteric fever? So choice A, is it bone marrow culture increases the diagnostic yield in those previously given antibiotics? It is a zoonotic disease. Choice C, incubation period is usually 4 to 6 weeks. And choice D, is it rose spots which occur in typhoid but not paratyphoid fever? And your time starts now. Yeah. So Computer ji, what is the correct answer? So again, the correct answer for this is that bone marrow culture increases the diagnostic yield and those previously given antibiotics. So the topic is of interest to everyone. Enteric fever is something which is not an uncommon disease, but I think an overdiagnosed disease because of the availability of Vidal test, reliability more on the Vidal rather than the culture test, and with the availability of serological tests like Typhi.IgM, we have been able to pick enteric fever earlier than what we used to do when we used to have reliability only on the blood cultures. So the differentiation between having a bone marrow culture is that bone marrow is something where we can even grow the organisms despite giving antibiotics. This is unlike blood culture or urine culture, where the organisms Salmonella, typhi or paratyphi, they may not be picked up when we do cultures. So bone marrow culture is one which should be attempted in case the diagnosis is not certain, but of course it is an invasive test, and it may be attempted only in cases where the diagnosis is questionable. Any other comments for this question? The treatment for enteric fever is, we all know that apart from ceftriaxone, certainly sometimes we may have to add azithromycin for resistant cases in the dose of 1 gram. And it is not
And-
that, yes, sir. Dr.
No,
Anand, sir.
nothing. Right. Enteric fever right now, this is the season basically because of monsoons. It is a waterborne disease, and bone marrow is considered to be a preserved site. So that is why even if you have given antibiotics to patients, then the blood culture may be sterile, but bone marrow cultures are usually still positive, and the yield can be in excess of 90% in these patients. So that is why if you have diagnostic dilemmas, bone marrow culture is one of the very highly reliable tests where you can actually test for salmonella and they will be preserved out there. In fact, one of Dr. Sudarshan will definitely recall it. Although even in my undergraduate days, I have not seen, but one of the very well-known complications of enteric fever before the advent of broad spectrum antibiotics was osteomyelitis. And many patients would today nobody will tell you osteomyelitis is because of salmonella. You have staph, etc., and all those conditions and hospital-acquired pseudomonas, etc. conditions. But yes, one of the conditions and complications of salmonella was osteomyelitis. Enteric fever complications was osteomyelitis. That was age-old teaching, but obviously it is more than 30, 35 years. And another thing is that this rose spots, if obviously fair skinned people, you find them easy, but rose spots are usually very transient and in early part of disease of enteric fever. But if you culture from the rose spots, again you will have a yield something in excess of 90-95%. So, but it is not an easy job because they are transient and patients usually, if they present late, you will not be finding rose spots in them. But I just wanted to make that comment, Dr. Ramesh. Thank you.
Thank you very much, sir. These were certain points of wisdom which really help, especially in these common topics where we miss and we try to find rose spots in our population and we may not find it. And of course, bone marrow culture, which you have highlighted. So let us come to the result for this question, Computer Ji. So again, we can see that 50% have been able to answer choice A, and 25% choice B, and so there is a lot of heterogeneity again in the answer. So participants are not very sure. So that's why the importance of the question comes when there is so much
Scrub
dichotomy.
typhus heterogeneity is acceptable, as Dr. Ramesh you were saying, but not for enteric fever. Scrub typhus is not that common as it is supposed to be, but enteric fever is quite common. And in fact, one of the differentials in any patient who has a fever of more than 1 week duration, it has to be actually, we should all be very well versed with enteric fever.
Very true, sir. Very true. Who is the winner of this question, Computer Ji? So the winner of this question is Dr. Vijay Lakshmi V, and she is from Stanley Medical College, Tamil Nadu. She has taken 1 second to answer this question. Congratulations, Dr. Vijay Lakshmi. So moving on to question number 17. Which of the following association is incorrect? Hantavirus, hemorrhagic fever with renal syndrome, E. coli 0157 by H7 strain causing hemolytic uremic syndrome. Choice C, Plasmodium species responsible for tropical splenomegaly syndrome. Choice D, Staphylococcus aureus responsible for Fitzhugh cutis syndrome. So your time starts now. The time is over. The computer ji, can we have the right answer?
This should be easy for them because they practice MCQs.
Yes, sir. It seems, sir. So the incorrect answer is Staphylococcus. It is responsible for this disease. So let us go to choice one, which is the hantavirus. Hantavirus is responsible for hemorrhagic fevers. I think many of us are familiar with this. And when the hemorrhagic fever is there, it may be associated with renal failure. And it was seen in a large number of military personnel who were working and who were on the mission in Crimea. And it has been associated with the fatal pulmonary syndrome also. So hantavirus causing hemorrhagic fever with renal syndrome and pulmonary syndromes is correct. E. coli, we
It
all
is a
know that
pulmonary renal syndrome and it is also known as HHRS, hantavirus hemorrhagic fever with renal syndrome. And in fact, this hemorrhage is primarily in the lungs. That is why it makes as a pulmonary renal syndromes.
yes, sir. And E. coli, sir, this strain is responsible for hemolytic uremic syndrome. I think this is also very much familiar with the participants. Let us see what is the result. And Plasmodium species, tropical splenomegaly syndrome is again responsible for chronic malaria, which is causing a massive spleen. And maybe we have one or more two questions on this, so I'm not elaborating on this particular thing. And the last choice, which is the Fitz-Cote syndrome, it is the chlamydia and probably gonorrhea responsible for causing this. And Staphylococcus aureus is not associated with this syndrome. So can we have the number of participants who have answered it correctly? So the almost as Dr. Anupam sir said that most of the students must be knowing this, and 76 of them are have good memory to recall, and they are right. And let us know who is the winner for this particular question. So Dr. Sheetal Arf, again from ESIC Karnataka, has answered this correctly, and she also must be leading or in the race for winning the quiz. So let us see. Let us come to question number 18. Another 3 questions to go about. Computer Ji, question number 18. Congratulations, Dr. Sheetal Arf. Question number 18 is on your screen. Which of the following statement is incorrect about brucellosis? It is caused by a gram-positive bacillus. Choice B, it can cause spondylitis. Choice C, it is tetracycline can be given for treatment. And choice D, chronic depression is a late complication. And your time starts now. So the time is over. And can we have the correct answer, Computer Ji? So it is caused by a gram-positive bacillus is incorrect. It is not caused by a gram-positive bacillus. It is caused by a gram-negative bacillus, which is Brucella species. And the organism can be Brucella. There are 3 species which can cause. It is Brucella abortus, which is from cows. It is Brucella suis from pigs, and Brucella miltensis from goats. And as we already discussed that ingestion of unpasteurized daily dairy products coming in exposure to animals, livestock can result in brucellosis. The choice number B and D are interesting, that chronic brucellosis can result in spondylitis and chronic depression. Yes, they are the complications of brucellosis which can happen in any patient. And acute presentations can be in the form of arthritis and endocarditis along with meningoencephalitis. So this is also a disease which can have both an acute and a chronic complications. And the treatment of choice is doxycycline plus an aminoglycoside. So Computer Ji, can we have the results for this question? Dr. Rajula Ramya from Kurnool Medical College, Andhra Pradesh is the winner for this question. Congratulations, Dr. Rajula, for answering this question. Computer Ji, we don't have the time for this question. Maybe, yeah, 55% of them have been able to pick it up. Okay, Computer Ji, the winner you have shown already, Computer Ji. We can go to the winner for this question. Yeah, I think she must have taken few seconds to answer this question. So just a second for answering this question. Yes, so we can go to the next question, Computer Ji. It will be question number 19. So question number 19 is on your screen. It is treatment of leptospirosis in penicillin allergic patients is A, gentamicin, B, chloramphenicol, C, erythromycin, and D, sulfa drugs. And your time starts now. The time is over and we can have the correct answer, Computer Ji. So erythromycin is the correct answer. Not a very difficult question, and I think Dr. Anupam sir and the other jury members must agree that we should have at least 100% for result for this question. This is a question which is of clinical importance also, and somewhat easy also. And if you talk about leptospirosis, we all know that leptospirosis can present with jaundice and some neurological manifestations, and the urinary contamination of the rats and similar organisms can lead to leptospirosis, and the patient can present with certain deterioration of their health in the form of jaundice, in the form of meningitis, in the form of other neurological symptoms. The point to remember here is that single dose of doxycycline or emergency treatment with ceftriaxone can be life-saving. So this is one of the diseases where the threshold should be very low in starting antimicrobials, and a good history, a good clinical examination, and good differential diagnosis probably can save the life of the patient. So Computer Ji, are we ready with the results for this question? So many of you have correctly answered. 83% of the students have picked up the right answer. And erythromycin is used in those patients who are allergic to penicillin, maybe in the form azithromycin or erythromycin. Both will work. So who is the winner for this question, Computer Ji? Again, Dr. Muhammad Akram Khan is the winner for this question. Congratulations, Dr. Muhammad Akram. So we can go to the next question.
Last question.
Yes, so this will be the last question of the quiz. And this is on your screen, question number 20. Which amongst the following does not occur in Chagas disease, American trypanosomiasis? A, is it lymphadenopathy? B, is it meningoencephalitis? C, is it Calabar swelling? And D, is it megaesophagus? And your time starts now. Yeah, the time is over. Computer Ji, can we have the right answer? Calabar swelling does not occur in trypanosomiasis, American trypanosomiasis. So what is this American trypanosomiasis or Chagas disease? Let us have a few points to know about it. That the disease can sometimes be asymptomatic, the acute disease, and there may be a presence of Shagoma at the portal of entry, and the patients may present to us with hepatosplenomegaly and lymphadenopathy. The complications which can arise out of this disease is that patient may suddenly land into cardiac failure and meningoencephalitis. And how do you diagnose it? That when you do a blood smear, like what we do in a diagnosis of malaria, you may see trypanosomes. Of course, blood culture may help you in confirming your diagnosis. And after the acute phase, there may be an intermediate phase, which may be asymptomatic, but then there may be some laboratory evidence of the infection. And chronic phase occurs after the initial infection, and it can run for decades. So It can have an acute phase, an intermediate phase, and a chronic phase. Interesting to know is that some rare complications like megaesophagus and dilated cardiomyopathy, they can be a part of complications of this disease. As far as Calabar swelling is concerned, they occur in loesis and not in this particular disease. So I believe this question will be a little difficult for the participants, and probably such questions give an opportunity for some, say, guesswork also, and to come upward in the race. So are we ready with the answers, with the correct number of participants who have answered this correctly, computer G? So again, there was a confusion between choice B and choice C. 42% have answered it as choice B and 47% as choice C. The answer is choice C. So who is the winner for this question, computer G? So I think Dr. Krishna Priya, I don't remember whether she was in the race, but she is from Stanley Medical College, Tamil Nadu. And congratulations, Dr. Krishna Priya, for answering this really tricky and difficult question. So many congratulations to all the winners who have been there in the quiz. And it will, I think, take some time for the computer G to come up with the final results. And meanwhile, we can have a little discussion. There are more jury members. Dr. Ghanshyam is also there now live. Dr. Ghanshyam, we were missing your voice in the last few questions. Yes.
Yeah, this last question also, I think Calabar, this nodule or a Calabar is also associated with a place in Nigeria, I think. And yesterday also we have a question on river blindness. So this is associated with onchocerciasis and river blindness because, but difficult question. Both the disease doesn't happen much in India, Chagas as well as this, and very well organized, very well conducted quiz, I think. And let's hope there's not a tie break. We have a clear cut win, and that will be Dr. Manjula and her team will be announced the exact results.
Yeah, they're calculating. They'll need another minute or so. So if we expect, yes, sir, Sudarshan, sir.
Yeah, both from the pediatrics and from medicine, what I noticed, we did not get any participant from Kerala and Pondicherry. This is for you to note, madam.
Sir,
Both
participants
pediatrics,
are there, but they did not be the fastest finger. Okay, that way.
But anyway, that is a bit surprising. Anyway, that is my personal observation. Because both are quite
Yeah, right,
well
sir.
known in medical field. Yeah,
Correct,
but
sir.
very surprisingly, at least even one from Pondicherry, one from Kerala. See, but very surprising. Not even one. Yeah. Anyway, it is speaking openly, frankly, that is a bit surprising to me. Over.
There were registrations, but
Yeah.
I think possibly they were not as fast as others. Possibly.
Okay.
That's it.
So maybe, ma'am, their emergencies are heavy due to this monsoon infections and all. Maybe dengue and all medicine residents and pediatric residents are busy in their emergencies.
No,
Maybe.
I think they would have logged in also, sir, because there were nearly 80 plus were playing.
Students.
So we would
Okay.
only see one person because whoever was the fastest.
Okay, we have a bit.
Good. No tie.
No tie. Yeah, yeah.
Okay. Yeah. So the winner for this quiz for South Zone is Dr. Mohammad Akram Khan, who has answered 6 questions as correct. The second is Dr. Sheetal R, and she has answered 3 questions correct. I think Dr. Manjula, these two will be the winners.
Yes, sir.
Yes.
And I have also totaled there are 20. I checked it, 20.
Yeah.
Yes, there are total is 20. Yes.
I do it every time, 20. Yeah.
Okay.
Correct. Total number. Yes, sir. Correct.
Yes.
So congratulations to the winner, and please, Dr. Manjula and others can take over from me.
Yeah, thank
please.
you.
Yeah.
Right, sir.
Yes.
Congratulations. Yeah, anybody would like.
Congratulations.
Yeah, Dr. Mohammad Akram from Government Sandy Medical College and Dr.
Correct.
Sheetal from ESI Medical College, Karnataka. So congratulations to both of you. And you are qualified for the national quiz competition, which will happen in November during FEFCON. And Fever Foundation team will get in touch with you and give you all the details. So I also would like to congratulate all the participants who took part in this. It was really, we had expert, it was playing, you were gaming, as well as there was a lot of knowledge that was shared by our experienced quiz master Dr. Ramesh Agarwal and quiz host Dr. Anupam sir, and our jury also pitched in, Dr. Sudarshan sir, in some epidemiological question, and our subject expert Dr. Shubha Lakshmi and Dr. Gansham sir were also adding lot of insights into. So it was a real teaching experience also was happening, your learning experience. So it was wonderful. And also please submit the poster, which I already mentioned. If you have posters, you can submit for poster competition, last date being September 10th. So, and lastly, I would like to say all the participants would be receiving participation certificate for having participated in this quiz program. So again, team Fever Foundation will be sharing you all these things. So thank you very
Madam,
much.
one
Yes, sir.
minute.
Yes, sir. Yes, sir.
This ESI Medical College, there are two in Karnataka. One at Kalburgi and another at Bangalore.
Ba-
Which one can
Yeah.
the
Yeah.
RX event, can they specify?
Yes, sir, they can.
Is
Atharva
it
or
possible?
Deepika, can you tell, is it Bangalore ESI or Kalburgi?
1 minute, man. Give me a minute. I'll just check in at you.
Yeah.
Just check in, because it is ESI. There are so many ESI medical colleges in the country. So anyway, this is because it is mentioned South Zone and Karnataka. I am curious whether it is
Correct.
Kalburgi or popularly known as old name Gulbarga or Bangalore. Just if possible.
Yes, sir, they can
for
check.
RX
Yes, sir,
event.
they have their registrations. They can check from the registrations.
Only 1 minute. Otherwise, we will postpone it and then we can log out
They
because it's
can check.
almost 9 o'clock now.
They'll check. Right.
Ma'am, it's Bangalore, ma'am.
It's Bangalore.
Okay.
Oh,
Thank you.
okay.
Thank you. Thank you. Thank you. Thank you.
Thank you, sir. Thank you,
Over.
everyone, sir.
Over.
I thank all the faculty for
Yeah,
that.
yeah.
Thank you so
Yeah.
much, sir. From
Thank
my
you.
Well, thank
Thank
you.
you.
Congratulations
Thank
to the
you. Thank
winners
you.
and thank you.
Thank you.
Yeah.
Yes.
Thank you.
Namaskar, sir.
Thank you. Namaste. Namaste. Bye. Bye. Good night.
Bye.
Good night,
Thank you.
everybody. Good night.
Good night.
Good
sir.
night.
Good night. Thank you.